Hello and welcome. My name is Tom Lehman. I'm a senior fellow at the Center for Early Learning Funding Equity, CELFE for short, and I'll be facilitating our conversation today among our presenters on the subject of mixed delivery, transforming our fragmented funding streams into a coherent funding strategy. I also helping me will be Autumn Hagstrom, our policy associate, who will be collecting questions from the Q&A throughout, and around 11:45 she will feed a few of those questions to the presenters to see how they handle them. We won't be able to get to all the questions, but they will inform us for going forward with this series and with other presentations. So please enter your questions as you have them. If the slide is in your way and you'd like to see the people who are talking, there, as you probably know, there's a line if you hover just to the left of the pictures of people. You can slide that line to the left and see more of the people and less of the slide. So now I'd like to ask our presenters to introduce themselves. I'll start with my boss, Theresa Hawley, and say something about, please, your background and your current work.
Sure. Hi, so I'm Theresa Hawley, the Executive Director of the Center for Early Learning Funding Equity. We're so excited to be able to share this work with you today and to do this webinar in collaboration with Nasha Patel, because we've found a true kindred spirit in this work on trying to build more coherent state systems for serving kids and families. So my background is I'm someone who, I'll say more about this in a few minutes, but in addition to 20 years plus of community level work, did 10 plus years at the state level working on early childhood systems. And now I'm excited to work at our center that is focused really on the financing of this system and trying to make more coherent systems as we move forward. So very excited about the conversation that we're going to have today, and excited about our format here, which is going to be super conversational. So hopefully it's engaging to you to hear what we've got to say about this. So Nasha, do you want to introduce yourself?
Yeah, absolutely. And thank you so much, Selfie, for having me on your webinar. My name is Nasha Patel. I'm a managing director at Watershed Advisors. I lead our early childhood portfolio, so I work with states and localities who are working to make systems work better for kids and families. In a previous life, I led early childhood work at the Louisiana Department of Education, and so come to my work with states and localities from a real perspective that is shaped by the work we did in Louisiana, but the opportunity to work with more states and localities and understand their contexts, what works or doesn't work for different states, what drives what works and doesn't work for different states, has truly been a really incredible part of this transition to consulting and supporting states. So now I get to work with states across the country, from issues ranging from sort of thinking about how do we make more innovative seat funding strategies to rethinking whole governance strategies in early childhood.
So while you both have national experience, I know we're going to ask you about your state experience, Theresa, in Illinois, and Nasha in Louisiana. So Theresa, would you set us up with the big picture? What's this webinar series about?
For sure. So Selfie has put out recently a set of briefs on the mixed delivery system, and really what it takes to move from this patchwork that we have of early care and education funding streams to a more coherent system. So if you haven't seen that, we'll be throwing that into the chat for you at the end of the webinar. We'll have some links to that too, and we'll send those resources out to everyone. But what we're trying to do here with the webinar today is to kick off our webinar series that highlights some of the things that we learned and that we put together as we were putting together that series of briefs. Again, really trying to highlight how this system could be improved. I'm gonna and Nasha's gonna share with us a little bit about, she's recently put out a framework from Watershed that it also amplifies and I mean could not be more aligned with the way that we've been thinking about this work here at Selfie. So super excited about the partnerships that may ensue here. So let's start off by talking about where we are now, or how we got into the mess that we're in. So in early care and education, we really have a coming together of four very different traditions that have built out services and entire systems in the early childhood care and education space. And they have their origins in trying to solve different parts of the problem of supporting kids and families in our country. So the first that really kind of came out of the gate is Head Start. So that, you know, we've got a Head Start system that's 60 years old now. It was born as a response to the needs of young children and their families in poverty. And it's a very comprehensive system. It is a federal to local system. There's a whole ecosystem of Head Start out there, whole way of doing work, a whole way of doing business, a financing model that has been built out for all of that. Again, very federal to local, a whole system for Head Start. In the 60s and into the 70s, with the federal legislation that pushed out services for young children with disabilities, and including in that children would be eligible for free and appropriate education from age 3 if they had a disability. So in what is now IDEA, we have the birth and the build out of an entire early childhood special education system, which is largely based in our public schools. And at the school district level, if you go and work with anybody who's in the school district world, they're largely, unless they're a state that's truly universal pre-K, their thinking about early childhood is very grounded in how you serve young children with disabilities. And then maybe the least restrictive environments you create for them about having typical peers and all of that kind of stuff. But there's a whole world too. It's got its whole funding structure. It's knitted into the K-12 education system in a way that much of the rest of our early childhood stuff typically is not. But it has its own requirements, it's situated within its own bureaucratic structure. In the 80s, there was a lot more growth of state pre-K, and from the 80s on to the present day, there has been huge growth in state pre-K. State pre-K often focuses primarily on school readiness, on it's an educational program, an educational intervention in the lives of children. There's sort of two different traditions within state pre-K that you can kind of block out at the way different states have approached it. Many states have done a targeted strategy. So it really is pre-K for kids who are at risk of developmental delays or poor school success, at risk of not being ready for school. So some do a targeted approach. Many states do a more universal approach. And so it really is kind of like just another grade that has been added to the early childhood system. Some have done that in a very school-based way. Some have done it in a mixed delivery way. So state pre-K is a big old jumble, but in any state that has it, it has its own bureaucracy, it has its own structure, it has its own way of getting money out into the field, its own requirements, its own rules, its own reporting back. Then you have the whole childcare world that is a mix of the private market and public investment in that private market, largely in the form of vouchers that support parents to purchase their own care within the early care and education system, or the child care ecosystem. So CCDBG started in the 90s. It built out of, the Title 20 supports that had been going on for childcare, but largely our country's investment really got going in the 90s there in supporting largely demand side investments in childcare. Again, letting people purchase their services within the childcare market. Childcare has its own bureaucracy, its own set of standards and requirements, its own way of reporting everything back up to the feds. Each of these programs in any state that you look at is going to have somebody who's in charge of that program and who is mostly oriented to how that program works and how it functions in the and what they're responsible for reporting back, what they're responsible for doing. So that's kind of how we got here into what I would say the mess we're in. It's all really good. There's this evolution of investments that we've done for really good reasons, but for different reasons. And we've built out entire systems and bureaucracies to serve those particular systems and projects. And we've got a system now that is all about funding streams, and maybe a little bit less about what it is that kids and families really need.
So Nasha, I'll ask you to start off a conversation, but I'm not going to call on either of you for the next 10 minutes or so. I'd like to know what's wrong with that. So we have 4 or more funding streams, and each one finds eligible children and enrolls them. In your experience, Nasha, can you give us any examples of anything wrong with that?
Yeah, absolutely. I think as Theresa just said really well, government exists to improve the lives of people, but when these initiatives are developed in these silos without any form of reconciliation, you see them bump up against each other when they are then delivered for kids and families. And there's headline after headline pointing out what's wrong about that for kids and families for sure. In my own experiences in Louisiana, where the state government really did, under the leadership of just exceptional leaders in the state government, say, you know, it is our job to step into this gap and to play that role of reconciliation, and to say a 3-year-old is a 3-year-old is a 3-year-old. And the thing that we should be focused and all in on is developing a birth to 5 system of care and education that essentially makes sense for a 3-year-old in any context. And our job is to take the funding and the requirements that come along with the funding and the various pieces of policy and make it make sense into a strategy that's aligned to a vision for kids. I'll say that when I started in state government, I didn't necessarily have the experience in leading that work on the ground in early childhood, but I was on the younger side. I started as a policy analyst on the team, but I very quickly saw how essential local leaders were to the work and to implementation. They were solving challenges in Louisiana that I could have never solved from Baton Rouge. And it just really quickly became clear to me how much my role in state government was to empower those closest to kids and families and classrooms to make the system work better for them, and to sort of center my efforts around what that looked like, and to play my role in state government of signaling quality, clearing out the noise, making it easier for them to do the things that made the most sense, and making the right choice the easy choice as much as possible for really a very fragmented and siloed field of providers, Head Starts, public and private schools, that all want to serve kids really well and are responding to what the system is incentivizing, prioritizing, or holding consequences for.
Yeah, I really resonate with what you're saying, Nasha, your experiences as you try to manage this from the state level, and recognize like you can't do it completely from the state level. Because what is happening on the ground. But I think, you know, my journey towards state government was a little bit different. I spent most of the beginning of my career at much more of the program or community level. So working with providers, or working in a provider. I started my career at Start Early, and worked really within the Educare movement. And as we tried to build out schools that were trying to meet the comprehensive needs of the actual children and families that we saw and that we're trying to serve. And we tried to draw down upon these different funding streams and integrate them at our program level. Or when I worked with communities on community level strategic planning for how do we get more early care and education services that can serve the kids and families that we have, trying to think about how are we going to draw upon these different funding streams because they're so strict. You know, then I so my kind of point of view was like, this is what kids and families need. How do we just use what's out there to fund it and to make it happen? And knowing how hard that is, how hard and exhausting it is at that provider level or at the community level to navigate all of this when it's not set up to be easy to navigate. So optimistically went into state government. We're going to do that. You know, we can fix this. We can make all this stuff work. I was just amazed at the degree to which the structures that had been set up for each of these different funding streams really dominated what the day-to-day work and life of anybody who was running those funding streams was. And I used to say, when I was in the Governor's Office of Early Childhood Development, like, until this job was created, it was nobody's job in state government to care about all, you know, at the time, 1 million children under the age of 5 in the state of Illinois, right? And took that on as my job, but it was not, the state government wasn't structured for me to have the authority to do much about that job. It became really challenging because the authority lies in these funding streams, and those authorities are then oriented towards the specifics of that funding stream. Did you find the same thing in Louisiana?
Yeah, I think that absolutely the role that we were stepping into and playing was to say, okay, this is true over here and this is true over here. Why is that? Why are they different? How do we make this better? How do we solve for as much of it as we can, recognizing that we can't solve for all of it, right? Their laws are laws and policies are policies. But what can we do to sort of take on that complexity and make it easier? But that took thinking about the system really dramatically differently. And it took being really flexible about what it looked like and what it could look like. And I think it took a number of years. The thing that really enabled it in Louisiana was the unified governance structure, was the fact that we had childcare, pre-K, the Head Start Collab office in one office for the first time when I came into that team as a policy analyst and sort of worked my way up to leading more and more of the strategy. And so that impetus of all of it being together for the first time really pushed us to ask the questions of, do these things have to sit as separately as they do? Do we have to run them in the silos that we are? Can we align more of these pieces together? And the thing that made it easier for me to get to, I think, the place that you were at, Theresa, of knowing and understanding the complexities and the friction points and the ways that localities were solving this, was a lot of conversations with the field, a lot of conversations with providers, with local leaders who told me, you know, this is what's working and this is what's hard. And I could sit in my role and say, okay, what's my job to solve for this? How can I make this easier? And, you know, what is the North Star of what we're ultimately trying to do? I think when your North Star is compliance with federal regulations and, you know, getting 0 findings on your CCDF report or from your state legislator, that does lead you to act in a certain risk averse way that policy and funding kind of incentivizes you to do. The easiest way to do it is top to bottom implementation, keeping it separate, keeping it clean and neat, and knowing 1000% that you are in compliance with what's in front of you. I think what we really pushed for early and took years to get right was the messiness of saying, well, what if we did it differently? How can we combine it differently? What if our North Star were building a system that could serve eventually all kids on their pathway to kindergarten? Not that it would be a requirement, but that it could do that if people wanted it, if families chose it. What would it take from the way we run systems in government? And I think that orientation, it doesn't mean you're not thinking about compliance, but it means that you're not centering compliance as the highest end goal. Compliance becomes a thing that you do, you check the box on it, but the highest end goal is a system that serves kids well in their pathway to kindergarten.
Yeah.
So,
And
so you both, Theresa, you have, I guess I'm more cutting you off than, than facilitating, but Theresa, you have talked about the problems at the local provider level. A provider may have 100 children and 30 of them are eligible for Head Start, and 70 of them, or let's not add it up. Let's say 20 of them are eligible for child care assistance, and others are eligible for state pre-K. How do you put all that together? How do you bill? It sounds like you were wishing you would have one funding stream that you could bill, which isn't about to happen, but that's what it feels like, I guess, at the local level. And then Nasha, you were talking more about the state level, and you actually suggest some hopeful ways of going forward. Um, so I want to ask Theresa, given these problems, and yet we still have 4 or more funding streams, and hopefully we'll have at least them into the future. Um, where do we start? What should it look like if we're going to get out of this?
Well, I mean, I really do think it is about asking the central question that we ask in our series, our brief series here is like, what would the system look like if it was redesigned from the point of view what kids and families need? And I think when you go and work at the community level, I think Nasha is exactly right about this, like that you got to have that community level part of the system, because those are the people who actually see children and families every day and come into contact with and understand what it is that kids and families need. So how do we start thinking about a system that actually is built around their needs and start building our financing strategies and structures around that? You know, Nasha also points out somebody's got to be in charge. Somebody's actually got to do this and be willing to take it on. It is really challenging, but what vision we're trying to put out there into the world is this vision of a unified mixed delivery system. This is what it kind of could look like. So this drawing here that we have is an homage to a dear colleague of ours, Maria Whalen. Many of us at Selfie worked with her over the years, and she had this habit of doodling in meetings constantly. At one point in her doodling career, she started drawing this picture of what it is that we were all trying to make be real for kids and families across the country. It was this gorgeous picture of here are the kids at play in a neighborhood, and there are family childcare homes, there are childcare centers, there are schools, there are community-based agencies with wraparound services, there are all these things. Well, we took that picture and kind of blew it out. What we changed about it to make sense for where Selfie is that we put in what are we hoping the funding actually looks like in this new future system that we would be creating. We would have this constellation of services that kids and families need, but we would be using our funding streams in a way that is looking at all the money together strategically, using that to fund out all these different types of services that we want to have. I do think that the idea of how could we blend funds together at the state level, if we're doing childcare and pre-K because we need pre-K for working families, could that just be one grant? Could that just be one set of money? What is our strategy for that? So it really is one system that's drawing from all the funding streams to support all the settings that kids are in, all those diverse models, importantly informed by the communities themselves in dialogue with the state about this is what we need, reaching all the kids and families because we're making services that actually serve their needs, and supporting kids' development in every one of those settings. And so not centering ourselves just on one kind of service that kids can need. That's what we're trying to envision. And what would it take for a state to get there? What would it take for a community to get there?
So, Nasha, I know you have a similar view. How well does this describe what you and your colleagues are looking at as mixed delivery? Mixed delivery, I should say, is a phrase that nobody really knows what it means. And so this drawing is suggesting at the top, it says all funding streams at all settings. Is that what you see as mixed delivery, and how do you see it?
Yeah, absolutely. I mean, I think there's so much about this picture and this description that is very similar to how I talk about it at Watershed 2 and in my framework. Could we go to my slide? So the way I often talk about mixed delivery, and it was a little bit of an aha for me in the last couple of months, was to sort of say, uh, we sometimes talk about mixed delivery as though it's a pre-K program strategy, right? Like, well, do you offer your pre-K in schools or do you offer it in mixed delivery, meaning in other settings? But actually, the reality that we all know to be true is that kids access care and education on the pathway to kindergarten through a mixed delivery system, whether or not states are administering one. They access care and education, as your slide notes, through a bunch of funding streams in a bunch of different settings with a million different permutations, right? It's not just that pre-K is in schools and Head Start's in Head Start centers, but Head Start can also be in schools or in childcare centers. Childcare funding can be in a whole range of places. And the various sort of local level funding streams that also contribute to this pot and this story, it truly does differ from locality to locality, community to community, state to state. So when we talk about what does that mean a state's role is in administering a mixed delivery system, I come back to these two sentences a lot, that early childhood programs and funding are well-intentioned but fragmented, leading to challenges for the populations that those policies are intended to serve, but that states are uniquely positioned to take on that responsibility of reconciling those silos. And they do that by centering the end user experience and prioritizing system coherence. What I mean by that is by taking on the responsibility of administering a mixed delivery system, of saying, it is not as neat as pre-K funding serves pre-K kids and Head Start funding serves Head Start kids, and it sits in these silos and we administer it this way. But to say kids and families access care and education through a range of different models and funding streams, and when we take on that responsibility in our own governance, if you go to my next slide, you can see how I like to think about, or how I talk about the 6 components within which you might embed that sort of mixed delivery frame. From state government in your organizational strategy of administering a function rather than a funding stream, of organizing by the different ways in which a system has responsibilities or charges, whether it's how families and kids find seats and enroll in them, how you define and improve quality, how you think about a workforce. State local partnerships, which I think I've talked about a lot and Teresa's talked about too, of the importance of saying, those closest to kids, classrooms, and families are the ones who need to be charged with implementing your plan. Your state plan will not work if only state agency holds it. It has to be in partnership with those closest to kids, families, and classrooms. To think about the funding structures that exist is take on that responsibility, even when not charged with it by any individual funding stream or law, to say all of the dollars that come through to serve kids need to work together to build an efficient system and stable system for kids and families, to define that North Star for quality and align every improvement effort to that, to build a strategy for your workforce that looks across the entire system and thinks about all of the various roles that are needed, and then to collect data on implementation over time, not just outcomes, but also how is it going? How will we know if it's going well? What will we need to do to adjust when we see this sign or that? This is how I often think about and talk about a mixed delivery administration from the state level. It's not easy, and nobody is asking states to do this or state leaders to do this, but I do think that many constituents would believe that this is the role of state government, and they're asking us to play that role even when it's not clearly charged for or defined by any one policy or grant.
So Theresa, I know Selfie has put some of these ideas on a slide, and maybe you want to speak to that. We only have a couple more slides of this sort, but maybe you want to speak to that.
Absolutely. So again, it's just such a joy to have a couple of us put together our different visuals, our different things. We are saying the same thing here, right? We're saying that at the state level, there needs to be coherence in what is how these funding streams are being used, that kind of unified planning and administration. In our brief series, we talk a little bit about the different options that states could have to do this. And many people on this call, webinar, I'm sure, are really familiar with all the different forms of state governance that are emerging out there. We have a strong preference, I think, for the idea that it all be in one agency, but that's not always possible. It doesn't always make sense for the way that state is set up. But it is essential that there is some state structure in which you're creating a state level plan that's across all of the funding streams. Your state strategy for supporting young kids and families with their early care and education needs is a single state strategy that incorporates all of the funding streams and all of that work that it's doing. How do you bring that all around together in one table and create that plan? That plan's going to be garbage if it isn't linked to what's happening in the real communities. That's just the reality of it. So we also, in our brief series, and we'll have some more webinars that talk more deeply about this, I think it's very important for states to invest in creating the tables at the local level, invest in creating those regional and community systems where there is coordinated planning at that local level. And again, super important that those are not two isolated events. That why you have that local level is for implementation, sure, but it also is for feeding back to the state what the state needs to know. The state can't know what is needed out there in communities if there is no structure by which the communities are feeding up that information to them and really reporting what it is. And is that like Nash, I know like in Louisiana, you really built this out. Nasha, do you want to say a word about like how like that kind of system had to work together in Louisiana?
Yeah. Well, sorry, which part?
But how the local regions were supported by the state, like you guys recognized you had to like help make them exist and have the structure to be able to do this community level planning, and then how that was linked to the state, not just on its own.
Yeah, exactly. Sorry for taking a minute to catch up. I think that in our work in Louisiana, we were clear about what the state's role was. It was to sort of set the expectation, fund the expectations, support folks to meet the expectations, and then hold them accountable to those expectations. But those expectations were not so prescriptive that we were saying the same thing is happening in New Orleans as is happening in Madison Parish. It was to say the system should exist in this to the same extent, right? Like we should be consistent about what the system is doing, but to know that the context in New Orleans and the context in Madison Parish were just dramatically different, and the local level solutions that were going to be driven there were also going to be very different. So where we held really tight was, do you have a community plan? Are you coordinating enrollment? Are you conducting the level of observations for quality that will help you make good decisions around quality improvement? We held really tight on those kinds of things, and we worked very closely with local leads on those issues, and they were truly partners, right? They had my cell phone number. They were calling me all the time. They were working with my team. They were giving me feedback, and we were giving them feedback. We were partners in the work. But the work evolved beyond what I or anyone else on my team could have charged any local leader to do. They and I think that's like the true metric of success of the work, is that it enables folks to um, reach the true potential of local level systems, not get in their way, sometimes get in their way, but not too much get in their way. While also saying, this isn't just going to be true in the well-funded urban areas of our state. This is going to be true in every rural parish in Louisiana. Maybe not to the same extent, maybe not to the same level of evolution, but some baseline level of expectation is going to be true in every part of the state. And a lot of our work was to reduce, to say, what do we stop doing so that we can start doing all of these things? And to say, where we have efforts that we are pushing out to the field, if we're not going to local leads or ready starts first, we need to have a really good answer for why we would circumvent that. And that kind of logic was really essential to our state implementation efforts, because it required a level of discipline that can be really hard when people are working in silos and administering funding streams in silos.
Absolutely.
So I would love to ask you a whole bunch of questions about both sides of this diagram, but I won't. But I'll say that it's coming up in future webinars is more depth on each side of that diagram. And right now, I will ask Theresa to just summarize kind of how you're suggesting we might get started with building a mixed delivery system in a state.
Yeah, I think what we're emphasizing here, both of us, is it's about a mindset shift. It really is about a mindset shift, and about how you're setting yourself up as saying, we're building a system that is about meeting the early care and education needs of all of our children. And then we're going to figure out the funding streams, the use of the different kinds of funding to meet that need, rather than we are going to continue to just implement well each of these individual funding streams. So it is about shifting your organization, shifting your work streams, shifting your thinking towards what is it that kids and families need, and like, let's really understand what those various settings are, what those various sets of programs are, looking at what's currently out there that you can build on, in whether you're doing this at the community level or as a state, looking at what's happening at communities all across your state, understanding what's out there, setting those North Stars. It really is critical. And that is not something that can be done in a back room. It's something that it's all about engaging everyone to have common agreement on what that North Star is, and then thinking about how you fund it. And you may not be able to fund your North Star only with the existing funding streams that you've got in your state. In fact, as we've been working with states across the country, we've been finding more and more that states are having to invent yet more funding streams that they're injecting into the mix here. We got places that are doing things like Massachusetts, really exciting, their C3 grant, where they're creating just base funding for childcare settings. In Illinois, we're doing our Smart Start workforce grants, where we're investing strategically in the wages of folks that in the childcare for. Like, you may not have from just the existing funding streams everything you need to make happen what you need to happen for kids and families. So it really is about that letting go of those first four puzzle pieces that we created. They were created at a point in time. They were created for purposes. What we need is a picture that fits all together. So again, coming back to the picture that we're trying to create, fitting what we've got from the puzzle pieces that we have so far, making them fit together, and adding in what we don't have yet.
So has either of you seen any steps in these directions? If you could give an example or two. And then finally, I want to ask, what do you recommend at this stage? But first, what have you seen?
Theresa, you want to go first?
No, go.
When I've seen states take this on, they are starting with that child and community need that Theresa described. So they start by trying to answer the question, how many kids are we serving across all funding streams? What are our gaps? And what level of quality of the kids that are being served, how many are being served at the highest level of quality? Too often, answering these questions requires going program by program, and we don't know when kids are double counted, or if a funding stream exists outside of a state government's purview. They're sort of like, we can't know that number. For example, Title I funds a number of 4-year-olds in Louisiana. If we were only counting state preschool, we would miss all the 4-year-olds that are funded through Title I. So our work is where we have seen states be successful is to say, okay, this question really matters. It matters for every level of planning, from the community level to the state level to our electeds' ability to do policymaking and budgeting. So we're going to put resources towards getting these answers right, and understanding them, and knowing that perfect doesn't have to be the enemy of good enough, of course. That doesn't necessarily, I saw a question in the chat that was about data systems. I think data systems are essential, but they aren't a prohibitive factor. You don't have to wait for the perfect or right data system. And in some ways, starting to do this work without the perfect or right data system can help you know what you need from a data system. So we did it in Louisiana on Excel spreadsheets with local leads, counting kids on a specific date. And when you start to get those answers, you can start to then say, okay, if this is our gap on access, what does this mean for how we spend money right now? If these are our gaps on quality, what does this mean for how we spend money right now? And that kind of an audit can help really set that North Star, and then ensure that every action that follows is really well aligned to the real needs of kids and communities in your state.
And I just want to give a shout out to the, the preschool development grant that, and the early childhood, or the early learning challenge before that. I sort of the thing that wasn't on our little slide, it looks like all development stopped in the 90s, but I would argue that like the 2000s and the 2010s and into the 2020s has been about trying to fund the glue here, trying to fund the coordination, trying to build out that coordination. So I think every state has, over the last 10 years, made at least some strides in this direction of trying to create a more coherent overview or plan of what's going on across the early care and education. Unfortunately, a lot of that's been in fits and starts in a lot of states. So we've had some states where that movement has happened in terms of governance. Sometimes that movement has really been just like the stuff that Nasha is describing Louisiana, where they really take it on of like, we're going to integrate this whole thing and have a strategy. Sometimes it's, well, at least we're all in the same building now, or we're all in the same office and we're talking and coordinating. But I think there have been those starts with things like the preschool development grant. I think every state has a long way to go to building out a truly coherent system. There are definitely bright spots. We look at what's happening in New Mexico. We look at all the states that have created new governance structures over the last 5 to 8 years. It really has been an explosion of development in this direction, and we need to keep going. I think we've also seen a lot more states that have recognized the value of those community collaborations and have started to build and fund those as well. I think there's a lot for us to learn about how we use them well and how they help push forward what we're trying to make happen in states and communities.
So, given all of that and your optimistic view, I would ask, with all of that activity, we still have the siloed funding streams. And do we know, is there, the concept of starting with needs and so on is a good idea, but what do we do? Have you seen any change in administration of funds? Or if you haven't, what would you recommend for administration of funds that would get us a true mixed delivery system?
Yeah.
Oh, sorry.
Go.
I think, the reason why I start with need is because I think when you ask the need question across your system, sort of not within one funding stream or the other, it starts to set up a solution of governance that says, okay, if this is what we want to be true, then how do we use our money to make it happen? Versus saying, we have this pot of money, how are we spending it towards quality? I think the more you can start with, what do you want to be true for kids, and align the funding to that strategy, the more successful you'll be in mixed delivery implementation administration. The challenge is that often these funding streams are siloed from the get, right? And so being really intentional about a unified state governance model and a unified state governance budget requires, in some ways, stopping things that already exist. And that's hard and feels complicated. But I think it's essential to get at the question you're naming, which is, if funding is what drives so much fragmentation and experience, how do we solve that? Well, the answer is a plan, and you don't get to a plan without changing a little bit of what's already been true for so long.
And I think, that many of these funding streams are federal funding streams that come out of, federal legislation. There definitely have been proposals over the years of, I would maybe call these the blow it up proposals that say, like, maybe we need to fundamentally rethink what Head Start funding is for. Like, does it become more of a birth to 3 funding stream because there is now the large state preschool funding stream, or it becomes a comprehensive wraparound supports for kids in poverty because the education function is largely being taken on, at least in some states, by the state pre-K. Do we want to change up how we're thinking about our childcare assistance and do more more contracts and grants and less vouchers? Do we want to, Build Back Better was for sure a proposal that was put out there for massive new investment under a new funding stream that isn't any of these, right? So like that, and that Build Back Better also had a massive investment in state pre-K and a way of doing that. Well, that there certainly are opportunities to think beyond what has been to what may be. It's not clear that we're in a moment right now at the federal level that there's going to that we may have some brand new investment that's newly constructed and newly structured. It's not also crazy that there might not be opportunities as fraught as the current moment may be to change up the way that the federal government is investing in these services and giving more flexibility to the states through the funding streams that it has.
So, okay, so there's a policy side, there's a governance side, there's an administrative side. It's complicated. It's good we have some more webinars coming up. And now is a good time, I think, for Autumn to come in and ask us any questions that have come in on the Q&A.
Yeah, thanks, Tom. We have a lot of great questions in the chat. I'm going to try to focus on the ones that I believe will not have the information covered in our future webinars. So if your question is not answered, please feel free to either send us an email, but also we really encourage you to register for those webinars, and Theresa will share more information about those later. One question, there's a little bit of chatter in the questions coming through about quality standards, and I'm curious if either one of you could talk about the role that standards have to play in our vision, or for your vision of a mixed delivery system.
Yeah, I can go first, Theresa, if you want.
Sure.
When I think about sort of quality standards, I think the first place to start is to sort of say, what do you want to be true for kids, every kid in your state, in terms of a classroom experience? And you can reach really high with that, right? Like you can go really ambitious and really big, but to start with, what's actually scalable in your state in, say, 3 years, right? What would that be? How do you take what you think should be true for kids in every classroom in the state and turn that into a set of priorities around quality? So like by the end of this year, certain things will be true. By the end of next year, certain things will be true. And really make those stakes in the ground, right? Like draw that line, make those stakes in the ground to force the pressure around. So then what does that mean we do with our state levers around a quality rating system, around standards for pre-K, around requirements for childcare? How do we really make sure that when we use these levers, we're not being overly harsh or punitive or requiring the wrong things or being distracting in any way, but really pushing the entire field at scale to reach your vision of quality year over year over year. And again, knowing you're not going to achieve your ambitious vision in 1 year or even 3, but you have to know where you want to get to by the end of 1 year or 2 years or 3 years. So when I think about quality standards, I think sometimes the complexity of the conversation is, what do we want to be true for kids because we care about kids and we care deeply about them having the best kinds of experiences? And what can we actually realize in year 1 versus year 2 versus year 3 that actually moves the needle and changes outcomes for kids who are 3 right now, who are being born right now, who aren't waiting for an investment that may take 20 years to materialize? I know that's maybe a different take, Theresa, than what you have, but that's how I like to think about the importance of defining quality, but being really, really clear about your gaps to it too.
Yeah. And so many things are informed by the system in which we grow up, right? And the system or professionally grow up. I don't mean grow up, but the system I professionally grew up in Illinois is such a tale of two cities kind of system where we've got a whole set of programs that have been super high standards focused and very research based, very, we have the certified teacher, we have the high curriculum standards, we have all these things within our Preschool for All program, and this high ideal we're holding to. And we have, like every other state, we have plain old licensed childcare that is not, it's not held to those standards, and it sure as heck isn't financed to those standards. So, so for me, when we think about what are our standards, what are we trying to do, I love having the real research-based standards of where we are trying to get for both for all kids and for kids that really do need more, the kids that are in poverty, the kids who have disabilities, the kids that need a higher standards program. But building tiered standards, building the ladder that brings programs up. So it isn't just, what can we do tomorrow for the entire field, and that's the only standard we should hold to. We got a lot of programs that are operating up here. How do we support them to continue operating up here? How do we take the programs that are down here and ratchet them up over time to meet those high standards? How do we build that system? The other thing I would say about this is that funding first, funding first, funding first. You don't hold people to high standards that you're not giving them the money to have a shot and heck of meeting, right? You got to give them the resources to be able to meet those standards if you're going to hold them to those standards.
Okay, I think we have time for one more question. I definitely have the hardest job on this webinar because there's so many great ones, it's hard to choose. Perhaps you both could talk, I know we talked in the mixed delivery graphic shows a lot of formal versions of early childhood care. Could one of you talk about where informal care like family, friend, and neighbor care fits within our mixed delivery vision?
I think.
I can
Oh, sorry.
I
go
can
ahead.
start with just like the one. I'm kind of falling in love with the way the Bainham Family Foundation is starting to talk about that there being sort of two paths here: trusted caregiver and early care and education setting. And I think that's, to me, that has been a breakthrough, helpful articulation of absolutely trusted caregivers and their role in supporting families and being able to provide that informal care that families need is a crucial part of the system. And there's no need to confuse that with early care and education supports that are about supporting kids' school readiness and providing those education services. If a kid's in a group congregate setting, that we need to be providing that level of quality and educational experience. To me, that's been a very helpful framework.
Yeah, and the thing I would say to like go even a little bit further out is to say, when you say that when we center the end user of kids and families and we talk about a mixed delivery system, anywhere kids are getting care and education is part of the mixed delivery model and part of what we want to influence through every component of quality and access and funding and health and safety. And so family, friend, and neighbor care, in my opinion, and trusted caregiver, however you would think about it, is part of that conversation, is an essential part of the space that you want to influence and bring to the table. Now, that is a harder one, and it's because it's more informal, and so it may take more time. You may not start there. You may start with the other places that are more easily connected to state government. But if you're operating from a mindset of trying to influence all the ways in which kids experience care and education on their pathway to kindergarten, they're a crucial part of that strategy.
Autumn, do you have a quick answer question? We have about a minute.
Yeah, there's an interesting question about what role does philanthropy play in a mixed.
I think philanthropy is essential in supporting the kind of glue work that we're talking about here, and also in supporting the kind of North Star development that I know when I was sitting in state government, foundations in my state were crucial in giving me that flexible money, like honest to God, just to pay for lunch so that we could bring people together at the community level, where like there's so many restrictions on you in state government that you can't use money to do. Being a real partner to state and local structures to provide those flexible resources, as well as to do the innovative stuff, fund the innovations that state government can't fund.
Yeah, I co-sign everything Theresa said. And I would say too that philanthropy can be a helpful accountability partner to states to make sure that in states where there is large philanthropy or even small philanthropy, that they're using their funds to help hold states accountable to this kind of mixed delivery and user orientation and thinking about how they're building that and in some ways funding states to do that work, to think about it from that lens, because we know that the individual funding streams they're not funding it or charging states to think about it in that way or in that capacity. And philanthropy can play that role of setting a standard, funding innovation where people are innovative, and also holding to account where maybe that innovation takes longer to develop.
Yeah, and I would add to that, holding the vision across the changes in administration. Gubernatorial changes in administration are really fraught for this kind of work. And I've seen philanthropy in many states play a great role of holding that across the transition so that it gets a new home and a new administration.
So, Theresa, where are we going next with this conversation?
Oh, we have so much more to share with all of you. I hope that you'll join us for our future webinars. So we have, it's September, October, November. We got it planned out here, following along with our mixed delivery spotlight series. We're going to be talking about data systems and community feedback systems, funding coordination, and braided funded contacts at the city level. So like some people have really done this. They've actually put the money together in a meaningful way. We're going to dig deep on some examples of where that has been happening. Also a little commercial for Nasha and me. We're going to be at the Build conference in December in LA. We're going to be doing a pre-conference. So if you liked this and want to have more conversation about this, please come and join us and sign up for that pre-conference at Build. We got a bunch of resources we'll be sending out to everybody after this webinar. So our spotlight series and the framework from Watershed Advisors, we'll be sharing these materials. And we want to hear from you. Tell us what's going on in your state. We want to stay connected with you. We want to hear your stories. If there's something that we can highlight that you think is going great in your community, or even that you think is not going great and you think that you would love for us to highlight challenges that you're seeing out there, please be in touch with us and let us know, because we want to bring this story, make it more real and more on everyone's agenda as we move forward.
So thank you, everybody. We have a thank you slide that says how you can contact. I think Autumn also may have put it in the chat. Thank you all. I'm sorry I can't see you all in this format, but I hope you enjoyed it, and see you next month.
Thanks.